Hello, we'll be discussing monkeypox in the Democratic Republic of Congo by Small Group 11. It's important to have some background on mpox. Monkeypox is a viral infection that causes a painful rash, fever, and swollen lymph nodes. It can be acquired through direct contact with bodily fluids, secretions, lesions from persons, or live or dead animals. It can also be acquired through intimate contact with infected persons, contact with items or surfaces contaminated by infected persons, or the consumption of inaccurately cooked contaminated meat from infected animals. In 2024, there were approximately 43,000 cases reported of mpox in the DRC. Of those, only 9,500 were laboratory confirmed, and case fatality rate was approximately 2.5% of all suspected cases and 0.4% of all laboratory confirmed cases. There are 5 preventative measures for mpox in the DRC. First up is vaccination. The general vaccine is highly effective in preventing mpox and smallpox. Therefore, ensure all personnel are vaccinated with the vaccine for mpox prevention in high-risk regions such as the DRC. The vaccine is highly effective as both a preventative measure and post-exposure intervention for mpox. Number 2 is personal protective measures. It's important to avoid contact with infected individuals or contaminated materials. Wear gloves, masks, and other personal protective equipment or PPE when necessary. Third is hand hygiene. It is vital for frequent hand washing with soap and water, especially after using the washroom or before meals. If soap and water are not available, use alcohol-based hand sanitizers when hand washing is not possible. Fourth is isolation protocols. Immediate isolation of suspected cases to prevent further spread. We recommend following the CDC and WHO guidelines for quarantine and case management. And lastly, awareness and training. Educate personnel on mpox symptoms, transmission, and reporting protocols. Provide ongoing health briefings and updates for leadership and personnel. There are other health threats in the DRC. First up is malaria. Use insecticide repellent with DEET, sleep under insecticide-treated bed nets, and DIP combat uniforms, and anti-malaria chemoprophylactics. For the Ebola virus, adhere to strict infection control practices and avoid contact with bodily fluids. For yellow fever, the best recommendation is to vaccinate. For cholera and waterborne illnesses, recommend drinking only bottled or boiled or treated water and avoid uncooked food and practice food hygiene. For HIV/AIDS, the recommendation is to follow preventative measures, including safe practices and awareness programs. And just general forest health protection recommendation is to maintain a robust medical readiness program, establish rapid response teams for outbreak containment, and monitor and report on emerging health threats proactively. Looking at the surgical capabilities in the DRC, it is found the DRC standard of care is well below the U.S. standards. Clinics lack personnel and equipment and often run out of critical medicines and supplies. An estimated 70% of Congolese have little or no access to health care. It would place our service members at great risk if we depend or attempt to use the DRC surgical capabilities. The closest surgical capability would be the U.S. Embassy in Djibouti, and we're currently reaching out to the Department of State to obtain information on their medical assets. There will be more information to follow once we receive this information. We request forward surgical teams for scalable support, and this would ensure that we're able to stabilize our service members before we move them to a higher echelon of care. Health service support for special ops service members involve 3 phases: stabilization, coordination, and definitive care. We will examine each of these phases in the following slides. Stabilization, we will use our Role 1 and Role 2 assets. The 18 Delta medic on-site provides immediate care to control bleeding, manage shock, and prevent infection. The injured service member is evacuated to the forward operating base or FOB for additional assessment by the PA or 68 Whiskey medics. The priority is a hemodynamically stabilized service member for medevac transport. For coordination, we'll notify the AFRICON Joint Operations Center or Joint Medical Operations Center for medevac planning. Determine the nearest suitable Role 3 care facility. In this instance, it will be most likely Djibouti or a partner nation's hospital. Also, engage medical evacuation services assets such as helicopter or fixed-wing aircraft for evacuation. For definitive care, we look at the Role 4. If higher level care is unavailable regionally, arrange for strategic aeromedical evacuation to the nearest Role 4 facility, such as Landstuhl Regional Medical Center in Germany, or depending on the prognosis and or operational requirements, a military or civilian hospital in the U.S. In summary, key forced health protection measures for Mpox in the DRC include vaccination, which is key for Mpox prevention. Hygiene and PPE is essential. Ensure measures to avoid contact with infected sources. Early detection and isolation reduce spread. And lastly, provide continuous education and updates to ensure awareness and vigilance. Thank you.